Body modification has been around for centuries, and in this episode we're going to be covering body piercings and tattoos. Now, it's actually really natural for people to get body piercings and tattoos because they're usually exploring their personal identity or just playing with their style. Both body piercings and tattoos can be removed, but please remember, if you do want to get your tattoos or piercings done, don't do it yourself or don't let a friend do it. There are professionals out there who have been doing this for years, so make sure you find a professional. Body piercings are also very common and they vary by site. You can get it on your tongue, you can get it on your eyebrows, you can get it on your ears, your navels or nipples. And other areas, they're not very common, but also the genitals, the vulva, the cleft, or even your knuckles. So you can get piercings almost anywhere you want to nowadays. It's up to you where you want to get them. Now, two of the most problematic sites are the navel and the ear because cartilage actually heals very slowly and the navel is actually a very moist area. Bacteria tend to thrive in moist areas, so it's very difficult for your piercing to heal in the navel area. Tongue piercings, on the other hand, actually heal very quickly, usually within 4 weeks, and this is because the tongue is such a primitive tissue and also because of the potential antimicrobial effects of your saliva. Infections usually result from the unclean tools of the trade, and these can lead to serious problems such as bacteremia, breathing problems, scarring, and deformities. Alcohol at any time should not be used to clean the skin, and your piercer should use all disposable equipment or should steam autoclave all his equipment. Piercing guns should also not be used. Number one, it's because they can't be cleaned properly, and number two, these guns work by crushing your tissue, and this can lead to getting the jewelry embedded in that tissue, which may require surgical removal, so it's more dangerous to be using a gun. You may think that it's fast and painless, but in reality it actually can hurt more. Metal allergies are also not uncommon when it comes to body piercings. When you're looking for piercings, you want to look for ones that are at least 14K, or stainless steel, titanium, or niobium. You never want to get gold-plated or jewelry with nickel because these can lead to the itching of the skin or cause an allergic reaction with your skin. Tattooing has been a Eurasian practice since Neolithic times. Ötzi the Iceman dated circa 3300 BC bore 57 separate tattoos, a cross on the inside of his left knee, 6 straight lines 15 centimeters long above the kidneys, and numerous small parallel lines along the lumbar, legs, and the ankles, exhibiting possible therapeutic tattoos. Treatment for arthritis. For most people, a tattoo is a lifelong liability. It should not be embarked upon lightly, and even with laser removal, that you can get them removed, they're usually painful, expensive, and time-consuming. Finding a tattoo parlor. Licensing usually involves completing a health department course on infectious disease transmission and passing an exam. But no governing body inspects tattoo businesses. Laws allow anyone to buy a machine, get a license, and start tattooing whether or not they have any artistic ability. A situation that most professional tattoo artists actually object to. So it's a good idea to do your homework before rolling up your sleeve. Here are some basic steps for choosing a safe tattoo parlor. Number 1, look around to see if the studio is clean and professional. Number 2, ask questions. Is there an autoclave? Are there needles and other materials single use? Are EPA approved disinfectants used? Do the artists wear gloves? Professional artists won't mind these questions. General consensus with tattoo artists also advises against removing any scab that may form or staying out of the sun for at least 3 weeks. Both can lead to a negative after image on your tattoo or not the initial image that you wanted to. It could be a faded image. For our next episode, we're going to be covering STDs and STIs, what to do if you have one, and why you should be afraid of even getting one in the first place.